Welcome back to another episode of Coffee with Coker. If you don't know, Coffee with Coker is a healthcare business podcast, and we talk about issues and solutions involving healthcare organizations, specifically talking about how these organizations can effectively navigate the changing healthcare industry. My name is Mark Stabile. I'm the host of the podcast. I'm also a senior vice president here at Coker. If you're not familiar with the Coker Group, we're a national healthcare consulting firm. We work with hospitals, health system, physician groups, and kind of everything in between as it relates to healthcare services. And so we're back for another episode today. If you have listened to the podcast in the past, you know our intention is not to get on and just try to sell services or talk about all the different things Coker does or any other company for that matter. We want to make sure that what we're talking about here on the podcast is topical, it's relevant to the marketplace, and the purpose is not to just get on here and pat ourselves on the back. We want to encourage you all to follow us, subscribe to us. If you want to hear more of our episodes that we've done in the past, you can find us at coffeewithcoker.com. You can also go to cokergroup.com and find the podcast there as well. Thank you for listening. We'll jump right into the discussion. I'm sitting here with two guests today. One guest is a now veteran of the podcast, Dr. Mark Knight, who is Coker's CMO, and he, as I said, been on a number of podcasts talking about different things. So welcome back, Mac.
Thank you.
And then we are also joined by a new guest who we're excited to talk to today, but his name is Mark Stabile. So welcome, Mark.
Thank you. Good to be with you, Mark.
Yeah, thanks for joining. And Mark, his company is called Team of Care. Coker and Team of Care are partners and are working on some new initiatives and ventures in the marketplace. And what we're talking about today ties back to something we've talked about before in the series on value-based healthcare and the shift from volume to value, and talking specifically about ValuePath, which again is something we've talked about on the show before, but really talking about how that journey towards value-based care begins. And we're going to be talking about some tools and solutions that hospitals and health systems can pursue in terms of making that progression. And so that's where Team of Care comes in, and some of the things that Coker has been doing with Mark and Team of Care. So I guess before we jump into the discussion itself, though, I'd like to, Mark, maybe give you a chance to just talk a little bit about your background, maybe kind of a high-level overview of where you've come from and how that ties into what you're doing today with Team of Care, if you don't mind.
Sure, great. So Team of Care is a workflow management system that we built very specifically to systematically enable performance in value-based care. So what we did was we said, well, what's being measured? What are the goals in value-based care? And then what actions, what activity needs to be done in order to achieve those goals? So the software is based on the concepts of workflow management in terms of defining actions, very specific actions or interventions, assigning them and routing them to the people who need to do that. We call that teamwork. And then the ability to see and have visibility to what work is being done and how it's making an impact, and we call that team management. Prior to forming Team of Care in 2012, like you guys, I was running a healthcare consulting company, and so I've had two different companies in healthcare consulting for about 15 years of consulting experience. A lot of it around healthcare, IT, and others around strategic implementation. And that's what led me to building Team of Care.
Great. Since Coker, we're provide advisory services. We don't provide software solutions, but in a lot of what we do, we realize there is a place where different solutions can really enhance the value of our implementation methodologies and strategies for creating value. And as we are really kind of still in the pioneering stage of this value-based shift, we have partnered with different companies and individuals that can offer those types of solutions as tools, is particularly that support value-based care. Matt, just give us a quick recap when we talk about ValuePath and what Coker does around value-based care. Just maybe recap that for us.
Sure. So as you all have heard me say on a number of these podcasts, the whole challenge, I think, in healthcare today, or one of the biggest challenges, is how do you transition from primarily a fee-for-service, fee-for-volume business model to a fee-for-value business model. And to me, as a clinician, that involves not only shifting gears with regards to your administrative and non-clinical workflows, but also with regards to your clinical workflows that now have to incorporate not only the reliable production of high-quality clinical care, but also doing that in the most cost-efficient way possible and in a way that benefits the greatest portion of the population that you're likely to be serving in one of these value-based or population health management type programs. So we've put together multiple elements of that here at Coker with our advisory services to include the care process design, the measurement of outcome measures, to include both quality and cost measures, a ongoing performance improvement program that allows you to take those outcome measures and use them to drive continuous improvement in the value that you're providing. And then, lo and behold, a few months ago, Mark Stabile and I got together, and I had been looking for some time for a software system that would help support this whole ValuePath program. And as Mark mentioned, his program is essentially a workflow management system, and that's exactly, I think, what you need to make this transition, because make no doubt about it, this is a lot more than just signing new agreements with payers. This is basically retooling your business and your clinical enterprise to operate successfully under a value-based model. So having a system that helps you to do that and to support that is extremely helpful, and that's why I'm very excited to talk about this more with you all today.
Yeah, and I think that's actually a good segue, because it's a great point in that the healthcare industry, and there's no shortage of software and solutions and technology systems that are out there being offered for various different things. Today, there are applications and solutions for, in theory, everything. I think what's interesting here is that it's not so much in how technology itself, the solution itself, is so revolutionary, but it's about how the technology or solution can be a tool in going through this process where there still are a lot of questions. We're still defining, what does value-based healthcare mean? What is it going to look like? And it's different for each individual organization. So it's a tool that helps facilitate that. And as a result, I think that's where the value is created. Maybe in talking about that, Mark, if you don't mind, tell us a little bit about how does this solution differ from other things that are out there in the industry, and ultimately honing in on that value creation piece.
Well, I think the first part of it is where you start, and we felt that, based on my experience from a consulting perspective, that it's always really best to start with, well, what are you trying to achieve? What's the outcome that you want to see? So when we look at the concepts of reducing costs and improving quality, those are the primary issues associated with the contracts. But most of the contracts also require care to be delivered and for the providers to have accountability for that care across different points of the continuum. And then there's this piece about risk adjustment. to say, well, how do you then adjust reimbursement to reflect the condition of the patients and complexity of the care you're going to deliver in the population? And so I think what's really different about our system is that we said, well, we don't want to tell providers how to deliver care. That's really it's not a good model for a lot of reasons. And but there are steps along the way that everybody has really pretty much accepted, agreed on, and sees as important indicators that we're moving in that direction. So we built this system to identify, well, what are those key milestones or those key activities, and how do we put the best information, not just data, in front of the providers and the rest of the team, so that when they take action, you can manage it. Mm-hmm. So, we believe that this is part of that shift that Mac was talking about. Was now you got to manage this differently as a business, and you want to be able to provide guidance to the staff, all of them, everybody, about what it is that you need and expect to do to perform, and then have some visibility to whether that's happening and potentially what changes you want to make.
Yeah, I think that's critical, obviously. I mean, we talked about it here on the podcast before, where data is essential, not just to what we're talking about here, but as executives and leaders are thinking about efficiencies and growth for their organizations, data is becoming more and more of a critical component, not just important, but absolutely critical. But I think what we're finding is there's a lot of cases where organizations and executives are getting overwhelmed with data. So then it becomes about making that data meaningful so they can translate that into action that then results in value creation.
Mark, if I might, let me just hone in on one word that we've already used several times today, but I think it really bears focus, and that is risk. So to me, the transition to value, the transition to a value-based care delivery model is one of taking on greater risk. And that risk really is in two buckets. One is clinical risk, which providers are traditionally quite comfortable with on an individual patient level. But they're probably not very familiar, most of us anyway, in how to manage clinical risk in a population of patients. Mm-hmm. How do you assess that risk? How do you stratify the members of the population according to their different levels of risk? How do you allocate healthcare resources to those individuals based on their individual needs and risk profile? And then the other thing that providers are very, very behind the ball on is how to manage financial risk. One of the things that I like about our approach is it takes you from where you are now, and indeed, Mark and I talk about this all the time, Mark Stabile and I, that there's various organizations that are at different levels of this path, this value path journey. And some of them are very sophisticated in terms of being able to manage risk, and both clinical and financial. They've been, for instance, in Medicare Advantage plans for a long time. They're comfortable with that. They know how to do it. And then others are just beginning to see this. They know MACRA and MIPS and alternative payment models are coming down the pike, and how do we get ready for that? So we take you where you're starting from, and then we help you to manage that risk, clinical and financial, that's being thrust upon you by giving you the data you need to support the actual operational efforts, again, both clinical and financial and business-wise, to make this happen successfully.
Yeah, I think that's a key distinction there, and I think breaking it down that way is helpful because you have to have all those pieces, and bringing that together sometimes is the most challenging or at least overwhelming part for leaders that are thinking about how to approach this. Mark, I know in working with you, I've heard you talk about what you walk through as what you term as 5 key success factors with value-based care. If you don't mind, maybe just walk us through that so that we can kind of understand what are the key components that we're talking about here?
Yeah, I actually think this is something that Mac and I have been talking about and just have really just codified as 5 key success factors that are across the overall business. And so the 5 things that we've been discussing are clinical integration, meaning network management and overall provider engagement across the care delivery system. Care process design, in terms of being able to have a sense for how you're going to manage delivery and then try to do it in repeatable ways that you can learn from and continue to scale. And then contracting for value-based care delivery is the third thing, and that is going to be a competency that going to develop more and more in on the provider side. It's going to require having a better sense of process and impact, which leads to the operational performance management. It's the fourth thing, where you start to look at, well, how are each of the different components of the organization, whether you look at clinical staff or support staff, or if you're looking at other partners in the continuum of care, where you start to look at, well, how are we performing operationally between those points and within those points. And then the last is revenue assurance, because if value-based care is really going to work, the organizations have to be financially successful and able to participate in those. And part of it's a no money, no mission issue. There's also just the ability to look at what your plans are going to be in value-based care, and to be able to take those 5 components, roll them together, and say, what kind of budget do I need in order to pursue our goals as an organization?
That's very helpful in terms of breaking it down or prioritizing the key components, I think. And taking that then and kind of drilling down even further, talking about the solution itself, tell us a little bit more from the context of where value comes from a tool like this that you may not be able to derive from your existing EHR system or rev cycle, practice management system, or any other system out there that you may get, and maybe start with dealing with kind of what I alluded to earlier, which was not only is there not a shortage of data, and of course data is important, but in this case, a lot of times I think we find ourselves dealing with being overwhelmed by the volume of data. Maybe talk about that in terms of the solution, if you don't mind, Mark.
Yeah, sure. So one of the first things that Mac and I started to work on, and probably one of the things that brought us together, was the idea that we feel you need to focus on how you align and operationalize those 5 key success factors, right? So how do these things work together? Right, because if you're tremendously advanced in one area and really not performing in other areas, there's going to be an imbalance. So the concept of risk adjustment and the risk adjustment factors that are used in the contracts to us became the foundational and rallying point. So and I can tell you that when we first built at Team of Care, when we first built our system, we didn't incorporate it. We didn't understand it. I would tell you, my experience in 15 years in healthcare consulting, I really didn't come across the concept of what are called HCCs, the hierarchical condition categories, and to do risk adjustment. It just wasn't part of the lexicon. And what we found was, well, that's actually a very important tool to understand how to prioritize within that data. So you were just talking about, well, I've got all this data. So we talked about it as too much data, not enough action. So if I first talk about too much data, we've got data in value-based care coming in from a lot of different sources. So you've got clinical, financial, and administrative sources. They're not all in your control. The data keeps changing, so the contracts can change each year. You can have other parts of that data that's going to continue to shift. And the issue and Matt can talk more to this than I can, although it's a topic in our daily topic in the company, is then you have a problem with whether the data is useful and if you have confidence in it. So in order to convert that data into information, you need context, and the contracts provide a lot of context for that. So we feel that we have to be able to summarize important data at a glance and help a provider and I'll talk about a provider for a moment, but to help a provider, instead of pouring through a 300-page medical record, to be able to look at a table at a glance and say, I understand what I need to do. The system is telling me that this information is or isn't available, and based on my clinical judgment, I know what to do clinically, but also based on my participation in this program, that I know what action I should do because the system's telling me to take this particular action. I don't need to guess at what it is I need to do best or next. So that's really the first part of it, is to be able to say, I've got all this data, too much data, not enough action. I can now take action. Right? And the next part of it is then to say, and now how do I manage it from the boardroom decisions about what our goals are and where we're going to participate, down to the practice, down to the exam room. There needs to be a way to align that. And so what we've done generally is identify how all of those come together and what actions will support that. But specifically, this risk adjustment factor piece, and I'll let Mac talk a little more about it, but the concept was, if you start there, you're addressing cost, quality, accountability across multiple points of care that are rallying around the concept of the risk of your patients, and you can prioritize using that data.
Yeah, I like that boardroom to the exam room kind of example or illustration there, because, I mean, and Mac, how many times have we worked with organizations where something is happening at maybe the board level or the executive or management and leadership level that just does not, for whatever reason, get translated into kind of that execution level?
Yeah, as someone that sat in the boardroom and been in the exam room, I can tell you there's oftentimes a huge chasm between those two areas. And the easiest thing in the world is to have a board retreat and set your strategy that you're going to, pursue the triple aim of, high quality care for individual patients, improved cost efficiency of care, and population health improvements. But it's a much more difficult thing to sit in the exam room and say, how do I actually translate that aspiration, that goal, into reality with the patients that I see every day? So let me just give you a quick kind of walk through, just an example of one way that this could work with our ValuePath program and the team of care solutions. So imagine you're a primary care provider. You work for a hospital system. That hospital system has now contracted with Medicare within a Medicare Shared Savings Program, a Medicare ACO. And one of the goals of that ACO is to improve the care of the patients in that population, that Medicare population, around diabetic care. So now what you do is you say, well, first of all, we need to assess the risks in the population with regard to diabetic care. And a team of care can go in and can look at historical claims data, pull out the hierarchical condition categories, use those to develop risk adjustment factor scores for each of those patients in that population, and provide you, the provider, with a list of your patients who and their risk scores and their individual HCCs, which may include diabetes or the various complications thereof. You then hone in on those with the diabetic diagnoses. You put them into a chronic care management program, which we help you design through our care process design system, systematically going through and saying, what does the evidence base say for how diabetics should be managed in 2018? How do you do that in the most cost-effective way, perhaps even using telehealth and other types of new care delivery systems? And then you use the outcome metrics that we also help you design to continuously improve that care process design system. So at the end of the day, your diabetic patients in that population of Medicare patients that you're now responsible for through the ACO you belong to are getting higher value, meaning higher quality and lower cost of care. And, oh, by the way, you're getting paid more for delivering that type of care because your payment is now triggered by your performance on both quality and cost measures. So that's one way it works. There's a lot of other tie-ins. The care process system that you set up, the steps in the care process of diabetes, that whole workflow can be supported and integrated through the team of care workflow system that Mark and I talked about earlier. So it all kind of just blends together. And again, hopefully that's a concrete example that gives you an idea of how this can be applied to the real world challenges that everybody's kind of up against these days.
I like that example because every organization, in theory, could go back through and start analyzing HCCs, but that's where you get into that, what Mark was talking about, the mining that data alone. You're dealing with such an overwhelming amounts, but then you got to understand, pinpoint exactly what you're looking for and break it out and further dissect it. I like, again, that example because you're talking about something that allows you to not only better hone in on those HCCs, then go in and look at it from a risk adjustment factor standpoint and the scoring there. You have actionable intelligence, if you will, that allows you to go and implement a program or execute a solution towards something that will achieve that triple aim at a very granular level, on the ground, if you will.
The old Pareto Principle says that 15% of your patient population is going to drive 85% of your costs. Mm-hmm. Well, the quickest way to find those 15% that you need to hone in on and manage their care meticulously is to have a system like Team of Care that can run that data for you and say, here's your 15% of patients that you need to enroll in a chronic care management program for diabetes tomorrow.
Mm-hmm. Yeah.
What I like about the way we're working together is that there's a real link between some of the decision making and your ability to facilitate some of those discussions to make decisions as an organization about, what interventions do we want to focus on, what populations do we want to focus on, and then here's a way to operationalize that. Because I think that it could be overwhelming for organizations, and it's different depending on, as you were talking about earlier, where they are in this process. So if you were to choose a particular, if someone just walked in and said, we're going to manage patients with congestive heart failure without knowing whether you got the data supports that, you could be spending a lot of resources going the wrong direction. But even if the data does support it, there still needs to be alignment in all those other areas, in those 5 areas, to say, well, organizationally, we have the right people to put that intervention in motion, so that you're doing this in the right time for the organization to be successful.
Yeah. As we think about this, and I think we hopefully have said this before and can't emphasize it enough, but Coker's model is not to go and sell a software solution. That's not what we do. as I said earlier, our goal is, where necessary, partner with solutions that help enhance the value that can be created through our assessments and advisory services and action that's derived out of that. So, in light of that, just in your own words, articulate why Coker is partnering with Team of Care and why this makes sense from a global perspective.
Well, it's funny because I have been putting together the various elements of ValuePath, which is, again, a suite of advisory services. It's consulting. It's not technology. It's a consulting program that helps take you from the proverbial volume to value through that switch. As the old saying goes, the more I got into it and the more I thought about it, I said, there ought to be an app for this. And lo and behold, there is. And that app is called the Team of Care solution. And again, just like almost anything you think that you're trying to do today that's in business or in healthcare or in any walk of life almost, it's hard to do that without some sort of technology support. And that doesn't mean that we're Coker is all of a sudden become an IT vendor. No, we're still selling consulting services. We're still selling advisory services to our clients who are trying to go through this tremendous period of change in the healthcare industry. But to do that, we think we also have to have IT systems that can help support them in doing that. And that's why Team of Care is such an important part of the whole ValuePath program. I will say, too, and we mentioned this a little bit at the very first of the podcast today, but one of the things I get from healthcare organizations all the time is, well, can't the EMR do that? Mm-hmm. We've got a software system on our computer terminals. Isn't that what we need to do value-based care delivery and population health management and all the stuff we've been talking about? And the answer is, no, it can't. Obviously there's lots of EMR vendors out there that are trying to develop products like this, but this is right now, today, up and running. It's been applied in various locations. It's got a proven track record, and it is not something that most organizations have in their armamentarium right now to try to help them do this.
Well, one of the things we've heard for years, this is a reoccurring theme, I think, that often comes up. And it's kind of this mindset or assumption that a solution, whether it's the EMR or something else, is the silver bullet that solves all problems. And the reality is there is nothing like that. And that's not to diss any one solution or vendor or anything like that. I think many of them will tell you. There are many different components, many different moving parts. And the reality is there are different solutions that do different things. It's all about where the need is and where ultimately value can be honed in on and created and generated. And so I think this is something that it's not a displacement type of resource, and it's not an end-all be-all, because as we talked about, you have to have the infrastructure, the resources, the systems, the workflows, the leadership. There has to be all the different organizational components behind any initiative, certainly an initiative as big as the evolution and progression towards value-based care.
Yeah, I as somebody who's probably the least techie person you'd ever want to meet, I can tell you that this is indispensable. And it is indispensable because there's a lot of people like me out there on the front lines of care who, don't have a PhD in healthcare informatics, but we need actionable data to help us provide value-based care at the front lines today, and that's what we do.
Yeah,
so.
That's right. As we've said, and Mark, I think this is directed at you, but the objective today was not to do a walkthrough or detailed demo by any means of the Team of Care solution. But we did want to highlight, we wanted to at least give a high level overview of Team of Care, what you guys do, and where you guys are able to really jump into any scenario and hone in on that value piece. But if people are interested in learning more, maybe seeing the solutions in action or some case studies where you guys have been able to create value in other cases, what do you recommend their first step be, and then ultimately where to find you?
Well, of course, I'd love for them to work with us together, with CwC and Team of Care, to just get into the ValuePath and take a look at the first step that we have in that. We've designed the ValuePath together in terms of how we work together with that to be a crawl, walk, run approach, where what we can initially do is provide an assessment regarding the HCC performance to help illuminate where there might be some significant gaps and opportunities. But of course, to just find out about us, there's www.teamofcare.com, and you can get some information there. And of course, anyone who's listening that wants to reach out by email, it's mark.stabile@teamofcare.com. And we'd love to explore this together with you.
Yeah, that's very helpful. And again, we'll make sure all that information is available in the show notes. And anyone that has questions, you can also reach out to us. We'll make sure we can point you in the right direction and get you in contact with Mark. But I think that's very helpful. And I think your point on the crawl, walk, run approach it makes a lot of sense, because this is something that, first of all, it's not a one-size-fits-all thing, meaning different organizations are at different stages of this process. Also, different organizations have different goals and objectives in terms of what they're trying to do, whether it's value-based contracting or it's addressing the risk equation that Mac, you walk through, whether it's on the clinical side or on the financial side, whatever that may be. And so part of that process, that first step, has to entail, in my opinion, that assessment component, in order to make sure we are honing in on where your greatest needs, where are some of the gaps that can be filled, perhaps identify some of the low-hanging fruit opportunities, and then you can progress on towards more of the larger, perhaps more ambitious objectives that could be on the horizon. But it doesn't have to be one of those things it's not going to be one of those things that's going to be a shift overnight, as we found. And it really, we wouldn't recommend an organization trying to dive too quickly into the deepest part of the pool here, I think. Well, this has been very helpful, and I know we'll have probably some continued discussion and conversation. Again, we're going to have some material and links to additional information in the show notes, and I know we'll be talking about this more as we talk about value-based care in the future. But until then, I thank you guys, Mac and Mark, for participating. And we'll look forward to talking about this again in the future.
Thanks for having us.
Thanks.
We hope you enjoyed that episode of Coffee with CwC, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.